This is a Black Nouveau web exclusive. We're continuing our conversation with Dr. Patricia McManus, President and CEO of the Black Health Coalition of Wisconsin. In February of 2018, she became the head of the health department for the City of Milwaukee. She served for more than 6 months in that interim position. Thanks for joining us. So, one question that I have is, did you really want the position to be an interim position when you took over, or did you want it to be a full-time position? Because people were sort of confused over that.
No, I came in being asked by people in the community to come in, but definitely interim. But interim could have been longer in terms of getting some other things done. I didn't have an actual time, but I clearly wanted to get back to the Black Health Coalition. I really had no intent, contrary to what people were saying, that I wanted to stay with it. And after having been there for a couple of months, that was, if I ever thought I would, no. Because again, it's hard to get things done, even when you have the expertise and know what should be done, when you have to have a political lens over it and everybody looking and saying they want things done based on how it looks or what they think people should do. It's really hard. Our community health has been the worst. It is the worst. This is one of the reasons I think why, because people aren't willing to do what they need to do to help our community be more healthy.
And why is that?
Part of it is we get blamed for not knowing, but nobody's teaching us. Mm-hmm. Part of that is the fact that you can't just tell people anything. Many of the things that are written for people around health don't fit us. It has to be interpreted a bit more for us to work with people. You know, when I work with young black teens or when I work with moms, they listen because I sound like them. I understand their life. And a lot of times they have these stagnant kind of protocols that they tell people, because I've sat and watched it sometimes, and it doesn't mean, because I got accused at the health department of not wanting white nurses working in the community, and I never said that, nor did I mean it, because I work with folks in the community. But there is a difference, and if you're not aware, I mean, just like I can't go to the South Side and I don't speak Spanish, you know, they have a culture beyond the language, and it's very hard for people to realize that what they're trained in school does not match with what people need to understand their health and to really work together with you, and they just didn't like that at all. They wanted to do what they were doing.
What surprised you the most in that position?
Actually, to be very honest, it wasn't just the mayor that I had issues with. It was issues with the Common Council too, and black members of the Common Council. That really surprised me. It would seem like once I got in there, I was kind of like on my own, you know, and it was some things that I recommended or wanted help getting done, they did the same kind of political lens that the mayor did. So there were things that I couldn't do, and that surprised me. I thought getting in there with such support, living in Milwaukee all my life, and seeing that we have a common council that's got 15, we've got 7 black council members and a Hispanic member who votes a lot of times with black members. And actually, I think I worked better with him than I did some of the black men. That's what surprised me most. I was disappointed in when things started going, the support I thought I would have gotten, I didn't get.
Yeah, so that was a question of support. Mm-hmm. Is there anything specific that you could point at that you felt like I should have received more support on this issue, but I didn't have the help that I needed?
Well, there wasn't one that stood, but it was how you did. When I started talking about that term, that deep state stuff, you got people in there who are just causing trouble all the time. And I was able to do some things, going through the systems, which I'm good at doing. I know how to do that. But getting help from when I need to get something done with the mayor's staff or something like that, and trying to work with the Common Council and getting that done, it was just, I'm over here, they're over there. You're kind of on your own. They didn't tell me that. I assumed that they asked me there to do the things that I needed to do. I mean, they never questioned that what I was doing was wrong or right. That wasn't it. But I just got this sense that they weren't going to step out on a limb and help me with certain things. You know, for instance, working hard to have some of these people removed, and some of them are still there, because that stops your motion when what they want to do is make sure they have all the work and get everything done. I mean, they want to do everything, so they want to make you look bad. I saw that do that to people who were already in there, And that was hard to do. That was really probably the hardest, because normally you're able to deal with administrative and personnel issues and deal with people, but that was really hard.
Probably the biggest issue has been the lead crisis that we have here. What has anything changed on that issue since you were in there?
Well, maybe it's changed more since I've been out of there, but there was some, number one, we got letters out to families, we called families, we got a bit more staff to kind of work with people to find out what's going on. But the key thing was to get some of those people out there. The person, be very honest, the person that was responsible for those letters not going out, she's gone. Because she was, it was found that she was very racist in terms of dealing with staff and working with people. And then some of the other people who were working on the lead side, because you got the abatement side and you had the prevention side. Prevention side is the nurses going out and trying to, the abatement side has to do with all the homes and stuff, right? So even the person who's on the abatement side, they were like, oh, city attorneys, they were like, well, he's going to fight it. Well, okay, let him fight it. And he fought it, but he lost. So I felt good about that, at least to have those folks gone. But if you don't have people in there following up then to make sure then that you're training people, you're getting folks in there, you're getting the work done, it just makes it, like I said, it makes it extremely hard.
Let's talk about your work with the Black Health Coalition. What's new? What are you doing now?
Well, what we're doing now is we're still working with the grant we applied for. And so we really want to get into working more. The Black Health Coalition for 15 years worked with infant mortality, so we were good at that. But we want to work with maternal mortality now, and so we have it's called the Milwaukee African American Perinatal Consortium or Collaborative, and it's made up of the Black Health Coalition, it's made up of the Milwaukee Health Services, the African American Breastfeeding Network, and then my father's house. So it's 4 African American organizations. When I had the grant before, it was just a Black Health Coalition. But this time, I wanted to expand it to others. So I reached out to all those other organizations and said, let's go after it as a group, collaborative group that we can do more for the community than just one group. And we did it, and we wrote a great grant. But we're not going to still whine and cry, because we're still going to do more work than even the grant, the folks that got the money. We really want to make sure we still work with our community, because we start with our babies. It really starts with the babies. We still have terrible infant mortality numbers. Our maternal numbers, we're missing a lot of women. So we're all kind of focusing in. That's our biggest piece that we're focusing in on now. The other thing for us as the Black Health Coalition is working on trauma. We do a lot of training of men working with them. They're in the House of Corrections. We go to the House of Corrections. We don't even get paid for it.
Thanks.
But we go.
Well, thank you for joining us.
Well, thank you.